Excellent. We got a great group tonight. And just as a quick reminder how Professor McCain will lead the conversation tonight with Dr. Katz, and then we will turn to three of the students who are enrolled in the class to to kick off the questions, and we'll then open it up to those students who are enrolled and then open it up to the
So thank you so much, Rebecca, for coming and joining us in what is a very crazy time of your life. As you know, this is a great group of students and the purpose of you being here is sort of to tell about the path that you took to get where you are. Everyone knows everyone's path is very straight and without any detours, but just sort of as we look back about where you were sort of when you were a sophomore or junior in college and what you were thinking about and what you were interested then and how that sort of led you into your next years.
You want the life story?
The shortened version.
Short
The
version
shortened
of the life
version of the life story. Yes.
Okay. First, apologies to those of you who have heard the life story before and are hearing it again. So I went to a small liberal arts school where I was a poli-sci econ IR major, about as heavy on social science as you could possibly get. But I come from a public health family. Both of my parents worked in public health. Both of my parents were heavily involved in different aspects of HIV/AIDS. And we didn't talk investment banking at dinner. This was, from a very early age, public health was all we talked about. And so but I was very interested in more political science issues, international relations. I got a bug very early on to travel as often as I possibly could and as far away as I possibly could. And so sought out every possible opportunity I could to leave the country. So I spent a lot of time traveling. And so I'm doing my degree, and I really thought I wanted to do health economics. I thought that I wanted to focus on resource allocation in there's a lot of math in an econ PhD. And I have to say I was a little intimidated by that. And especially because I had gone to a college where one could take high-level economics classes without calculus. It was one of these things I thought about the concepts and instead of calculate them out. And so I stepped a little bit away from econ, and I was like, well, you know what? I think what I'll do is a master's in public health. But I took a little bit of time off, and my graduation gift from my parents was a plane ticket to India. And I went and I was a volunteer in maternal child health clinics in southern India. And I was supposed to be there for a year because I was supposed to spend the first half of the year doing this MCH work, and then I was scheduled to actually spend 6 months working with Mother Teresa's as a volunteer with her. While I was in India, I applied for MPH programs from there, and I was all set to go. And while I was there, I ended up getting quite sick. Sick enough that I came back into the country undiagnosed, which was quite an event. And I was home, and I was ill, and it took about 8 months to figure out what I had, and then to start treatment. So, in the interim, I then start a master's in public health, and it was still called international health at the time. So I was doing that, and also focusing on infectious disease epidemiology. And it was this kind of bizarre juxtaposition because I was studying how to think about health on the population scale at the same time that I myself was a patient. So I would go in the morning and get my IV antibiotics at the health center and then sit in the back of the room so I could run out and throw up while I was going through my classes. So in my head, I was a patient, but I was also, so it was really kind of this odd time in my life of trying to figure out how to think about population scale at the same time going through a very... And turned out that the thing that I was sick with was something called Brucella melitensis, and it naturally occurring disease in southern India that I got the goat version, so either through infected coffee in my milk or airborne. And I came back and I'm in the States. I'm going through treatment. I'm doing my coursework, and when you have a disease that people don't really see very often, if you are able to, you have to become your own expert. So I showed up once in an emergency room in Stamford, Connecticut, because I had gotten a pill stuck in my throat and ulcer in my esophagus. And somebody's like, wait, which one is that? Like, is that the thing with rabbits, or is that, it's just not something that people see very often. So in the process of becoming an expert in my own disease, I found that the best literature I could find was the bioweapons literature, because this thing that I had gotten sick with turned out to be the first agent ever weaponized by the U.S. as part of the offensive biological weapons program in the early 50s. Here I am studying, I'm in my public health master's degree, I have my very own disease, and I'm reading all this literature, and things are clicking for me. I'm like, wait, I have this poli-sci econ IR background where I'm really interested in the word terrorism is in here, and I've never heard about this before, and here I am studying epidemiology. So I started to get really, really interested in this intersection between disease and security. But this was the mid-90s, and this wasn't something that people in the public health community thought about ever. So I went on with my life. I went and I graduated. I started working in public health consulting. And a couple of times during that process, I was able to work on things like, disease surveillance and stuff where I realized that the stuff I was reading on the side on this whole disease and security and bioterrorism stuff, I could actually do for a living. Like, it was hard for me to make that connection, because again, this wasn't something that people in the community were talking about. So I guess it was 98, 99, I applied to go back to school to do a PhD. I thought I was going to do it in infectious disease epidemiology, because that was my interest. But I really wanted to do this thing of disease and security. And at the time, the schools of public health weren't terribly interested in that. So I was being told things like, we like you, but not really this topic. Or this might take an extra year to get past a dissertation committee. So I ended up, I followed the person who had been the dean at the School of Public Health that I had gone to at Yale, who had moved on to Princeton and was in the Woodrow Wilson School, so a public policy school. And he basically said, listen, just come here. We'll take your courses in national security, we'll combine it with your epidemiology, we'll just make it work. And he took a risk on me, because this was just not something anybody was talking about. But yet a year into my study, when you're doing a PhD, there's all sorts of exams that you have to do, and I had sat for exams, and then I was asked, as one of my general exams, I was actually writing a paper on public health and national security. And everyone was kind of humoring me, like, oh, that's cute, she's interested in this stuff. But I handed it in on September 10th, 2001. And then everything changed, right? So you had the 11 attacks, you had the subsequent anthrax letter attacks. A lot of people who had previously had kind of humored me and thought this was cute were suddenly like, oh, wait, yeah, this is a thing. This is a real thing. And so I think, wrap it up, but the idea is that it's, you go on a path, but then you're also subject to just what's going on in the world and how that influences where you are. So I ended up doing an internship in the intelligence community. I was basically given a dissertation topic that then introduced me to a whole bunch of people in government. while doing that process, I realized that a lot of things I was interested in weren't actually happening in academia, they were happening in government. So I had kind of made the decision that I wasn't really going to go into academia, see where that gets me. Um, and, uh, and then again, life gets in the way. So when I was coming out of my PhD, I was talking to a whole bunch of different government agencies, but and hadn't really decided which one I was going to go to. And then I get pregnant with my first kid, and I have made a whole bunch of decisions, as many do, based around family, and decided I didn't want to take a government job where I was going to get 6 weeks of leave, and then and then use up all my leave forever and ever. So that also influenced what jobs I took, where I went. I ended up taking a consulting job with State Department instead of a regular full-time job. I'm doing that, and then my master's thesis advisor had moved from Yale to GW, and had said, "Hey, you want to do some lecturing for me?" Sounds great. So this was Peter Hotez. So I was doing some lecturing for Peter, and then Peter said, "Hey, do you mind if I pass your resume on to the School of Public Health here?" Sure, why not? I go into the School of Public Health, and I meet with the head of the Sarah Rosenbaum, who was head of the health policy department, who said, "Hey, do you want to be faculty here?" And I'm like, "I'm pretty sure this isn't how this works, but okay, sure, why not?" That was my path back into academia, and then I'd say for 15 years, I kind of held these dual hats, where I worked at State Department part-time, and then I also worked in academia, and built up this research portfolio in health security. What was it now? Almost 3.5 years ago, we moved the entire team, the research team from George Washington University over to Georgetown, establish a Center for Global Health Science and Security. That's my life story. Sticking to it.
It's obviously, yeah, really, really incredible. And I think one of the things is that so many of us have our parents, they sort of shape what we're interested in. So you had sort of public health, but then your own life circumstances sort of changed you from maternal child health in India to infectious disease and a choice to go into government or academia. But can you talk a little bit more about what it means to work for the government? What did you... because I think, I mean, unless you're there, and we sort of talked about this last week, is you work on Capitol Hill. Oh, that sounds great. Well, what exactly does someone do? What does it mean to work when you were interviewing for these jobs in the government, and why? Because what was the power, the advocacy that you were able to do from that maybe you weren't able to do in academia?
Well, I should first say I'm the only non-clinician in my immediate family. So.
Or maybe we can start with that, which is, did you ever think about going to being a doctor?
No.
Okay.
I will say, in the late 90s, when I was doing a lot of public health policy work, I was really frustrated because, you work on this high level, but there was like a disconnect to people. And I became an EMT at that point, and I started doing that, and the rest of my family is like, "I don't get it. Why don't you just go become a clinician?" And I kept trying to explain, like, it's not really the same. I mean, like, it's I like having, touching people and like being involved with human beings. Maybe this says something about my interest in acute events and response, but I found the emergency situation kind of aligned with my interests.
In your next life, you can be an emergency room doctor. But in this life, so what was you're just talking about what does it mean to go into the government? What interested you?
I have to say I hadn't really planned on it. I think my takeaway from my life is that I've had a bit of an accidental career. But I got recruited. In the late 90s, early aughts, I said I was one of very few people interested in this intersect between disease and security. And unexpectedly, I was reached out to see if I was interested in joining the intelligence community. And I was going off to do my PhD, so no. But I was really intrigued because I'm a public health professional, and that just wasn't, I didn't grow up thinking I was, you know, I read spy novels, but it wasn't something that I thought would ever be a place I would go work in my career. But so I was really intrigued, and so the summer after my first year of my PhD, I went and I was an intern at, within the intelligence community. And it was great because they paid by the number of college credits you had, and at that point I had 2 master's degrees, so I was like, this is great. And I learned a lot. I had no idea what that job would look like. And let me just say, you know, when I say that job, I was working a very specific analyst position. I was not a spy somewhere. I was you know, reading and writing. But it was intriguing, and I was really interested in it, and so and that led me to meet a whole bunch of people from different parts of the U.S. government. And when I guess it was 2004, I started working for the Department of State, and I have to say, it's a funny thing you asked. My husband, when he was getting out of the Navy, and actually interviewing for jobs and was trying to figure out what he wanted to do life, used to talk to people about what they did, and they would describe, you know, I work on equities, and you know, whatever it was, and he's like, no, I want to know, do you talk on the phone? Do you type? Like, what do you actually do all day? He was really trying. It was like very literal. Like, what do you do? And I guess for somebody who was coming off of a submarine, like he just wanted to know what people did in a regular job. You know, do you go to meetings? Do you, like, what does that mean? So for me, you know, I'm not going to tell you how many, like, you know, people sometimes ask, you know, if they can shadow me, like you would somebody in a hospital. I'm like, do you just want to watch me type all day? I don't really understand. So what do I do all day? I type. But I think what did it mean for me? For me, so when I went to State Department, my jobs, plural, there over the years really shifted. So when I first started there, it was a lot of, I used to do intelligence briefings for the assistant secretary, and trying to explain what potential biological threats might be relevant. And so that was a lot of, you know, research and then briefing and sharing that, and then sitting in the back of a room for years before I even thought about sitting at the main table for government-wide meetings on things like the Biological Weapons Convention, what the delegation should look like, and then some of the White House interagency meetings. And I'm not kidding. I think I spent multiple years sitting on the outside of the room before I felt comfortable joining the big table. So I think, you know, for me, it was my work in government was supporting the U.S. delegation to the Biological Weapons Convention. In 2005, it was a lot about H5N1 and helping to support the efforts to build an international coalition among ministries of foreign affairs to think about pandemic preparedness. It was attending a whole bunch of interagency meetings on a whole bunch of different subjects, and trying to be a public health expert and trying to bring that substantive expertise to the table. And I have to say, when I started at State, it was a lot of foreign service officers and a lot of people with kind of very, really, really smart people who, at the core, were generalists in international affairs, and you didn't actually have that many people walking around the building with PhDs who could spell epidemiology, let alone, like, you know, was one. And over the last 15 years, that's changed so dramatically. A lot through the program to bring people with PhDs into government, the AAAS program. So it's
the American Academy for the Advancement of Science, which is a great program. If you go and get your PhD and then you realize you don't want to be in a lab and that you actually really like people, it's different than this, but this is the way that many of my friends explain it, wow, there's this program that can take all of that technical expertise and give you a policy job in government or on Capitol Hill, which, as you said, is really desperately needed.
There is a wide range of people who think about it a lot, who support it, and when it meets normally twice a year in Geneva, governments send delegations. Some governments will send will send one or two people. The United States government tends to send a much larger delegation, trying to represent the breadth of the executive branch and the equities that they have. My last number of years at State, the office I was in was called was in the International Security and Nonproliferation Bureau and the Biological Policy Staff. And I worked for an office director who was the main point of contact for the Biological Weapons Convention, but we staffed an ambassador in Geneva. So the ambassador to the Conference on Disarmament. And so coming into, say, a review conference for the treaty, there are lots of different people who are involved. You would have maybe an undersecretary, you would have an ambassador, you would have a whole bunch of experts from across the interagency, all representing a whole bunch of more people back at their agencies. And my job for many years was trying to bring a public health perspective to that delegation. So what did that mean? And so back to my husband's thing, so what do you actually do? I wrote a lot of talking points. For whether it was for the ambassador, for somebody else, because of my role in academia, I spent a lot of time coaching and prepping other people from the U.S. government on how to give a presentation if they were going to be delivering something to this audience. I helped coordinate assistance, some communication from the U.S. government back to the rest of the delegates who would come to Geneva, and also just being physically available. So if a question came up on preparedness and response or something on disease surveillance, the person sitting in the chair for the U.S. could turn around and say, hey, do we have this right? So it was a lot of trying to bring deep subject matter expertise on a topic and being able to support folks who had to go into negotiations with other ambassadors or bring something to the White House.
So just one other piece. What do you think? You're from the United States. You're a U.S. citizen, and when you work for the government, you work for the government of the United States, which is very different in this arena than if you were born in a different country and you happen to work for that government because of the international power that we have around these issues. I remember at the Ebola outbreak, at some point in time, there was a conversation of, do we really need the World Health Organization? We have the Centers for Disease Control, which is not a good recommendation. But how do you see working for the U.S. government on these issues with all of the sort of technical expertise that large 70-person delegation that you bring to this, which...
You only bring 70 people to a World Health Assembly.
Okay.
DWC is more like, 15.
15, okay, excuse me.
That seems huge. So let me just first say, I'm saying this now, and it's the reason why I didn't give any disclaimer up front. I do not currently work for the United States government. Otherwise, I would have given you some long disclaimer about how nothing I say represents anything, the Department of State, the United States government, or anyone but myself. So I should make that very clear that I handed in my badge and my diplomatic passport in September. So I can speak to my experience in the past. I think this is an interesting time where international norms and governments and the U.S. role is shifting. It maybe not as strong as it had been, and other powers are rising up in, I don't want to call it a vacuum, but in a diminished capacity. That being said, I think it is very fair to say that, you know, CDC still is seen as the expert in outbreak response, in disease, in the control of communicable diseases, right? The U.S. government is still seen as a major player, as a deep bench of expertise, and there is still a lot of information sharing and collaboration that goes on. I'm not quite sure how to get at. I'm not sure what you want to get at. Like, what does it feel like to be part of the representing, or what's going on now?
I was just thinking about the fact that when you're working on these issues and you're sort of representing your government, you are at the same time representing and working with some of the best technical experts globally.
Yes, absolutely.
And so so I guess there was just that feeling of you're bringing an expertise that is unparalleled, and then to leave that and go into academia. And so why walk away from that, and what does the academia provide?
Well, I never went totally in.
Okay.
So, I throughout
Having
my
only left
entire
the state
time
department.
in government, it was always a part-time gig. I had a really unique position. When the Arms Control Agency became part of State Department, they grandfathered in a hiring clause for what's called an expert consultant. There aren't that many of us, and it allows us to work to be considered like a regular government employee. Like, I carried a diplomatic passport. I could officially represent the United States government abroad. I wasn't thought of as a contractor. I was treated like a regular full-time employee, but billed by the hour with no benefits, and that worked perfectly for me. So it's a really unique position that it doesn't. There aren't too many people who do that, and it's very similar to how a lot of the retired Foreign Service officers operate, and you're limited to, I think, 130 days a year or something like that. So I never went all the way in. So I always kept some balance with academia, and that balance shifted over the course of a decade and a half. So when I first started off, I was like, up to my limit of number of days per year, and by the end, maybe an hour a week if I was able to. So it really shifted over time. So I think, but it was also. My field has shifted over time too. So when I first started all of this, coming out of my PhD, I did global health in academia, and I did the security space in government. Over the period of a decade, that kind of dialogue around health and security and the interaction really started to shift and come together. What I did for whom started to shift a little bit, and I have to say I've found it. One of the reasons I finally handed in my badge was that I found that I was actually able to have a strong voice from academia and still influence or try to influence policy discussion and debate, as well as clearly, if anybody ever cares for or wants my help, it's not like I'm not going to answer the phone. So it's what we do. So I think that it's been a really interesting shift over time, and trying to kind of navigate those waters, and what did I do in academia versus what did I did in government, and where those lines were.
So just on the what you do. So here at Georgetown, you've had a very interesting couple of weeks. It's just shifting to the coronavirus outbreak. And we talked when you first came in that it feels like 2014 all over again. And so I just want you to sort of explain to the students what that phrase means, what you were doing in 2014, and maybe the specific work that you're doing now to help prepare students at Georgetown.
So first, I don't treat patients. those folks treating patients are a lot busier. So my reference to 2014 was when Ebola West Africa emerged. There wasn't enough noise for a long time. There wasn't the virus was spreading. There were calls for assistance. They were not necessarily met with the gusto that they should have been met with. And it wasn't until August 2014 that the West Africa Ebola outbreak was finally declared a public health emergency of international concern, and that is about the same time that the United States government and the U.S. military and the large scale push happened from the U.S. And that was also about the time when. So there was the work I was doing in government, but also my hat in academia is, part of the job of a public health professor is just to explain, public health to the public. So we were taking lots and lots and lots of press calls at the time to try to explain what was happening in real time as the press was covering it. So that's a little bit what it feels like now. So just. For reference, if you are not following this very carefully, a new coronavirus emerged looks like December in Wuhan in Wuhan in China. Initial reports were that it was linked to a fish market. It has since exploded, and we've now seen several thousand cases. If I cite you a number, that number might have changed in the last hour. So things are evolving very rapidly. The Chinese government has amazingly, done basically a cordon sanitaire of tens of millions of people, which is not something that we could even contemplate here in the U.S. or even if we wanted to. So there's just there's a lot happening. There's a lot happening in terms of thinking about global governance of disease. There have been discussions about how the international health regulations are being utilized. There's discussions from these kind of high level governance questions.
Can you define the IHRs?
And so the international health regulations is kind of the treaty for global health security, and it guides the cooperation, it's for prevention, detection, and response to acute public health emergencies, and it provides a framework for not reporting as well as response, and how the international community works together in response to one of these emerging events. And so a lot of that is spelling out kind of what is the role of the World Health Organization and what kind of information and actions countries should be taking. So there's this very high level governance issues going on, and then it's global to local. All public health is local, so we can think about things as an international scale, but also what are we actually doing on campus, for example. So and then there's been a lot of discussions of thinking about how to prepare even at the university level, which we have been trying to be as supportive as possible of the university and trying to provide our hopefully our subject matter expertise in contributing to those discussions, and then at the same time trying to again serve that role as trying to hopefully explaining public health to the public by doing a lot of calls with different press outlets, and at the same time trying to be very active through social media and all the different ways that public health is now communicated. So it's been it feels like we're all sprinting, even though we really need to be preparing for that marathon, because this is not going away anytime soon.
The role of communication in public health cannot be understated, and the communication of difficult ideas and the importance of data in a way that makes it accessible to the people who need to be able to act on that. And you probably never knew in your life you would also become a communications expert, in addition to all
I'm
the other
not.
pieces.
I mean, full stop, I am not. We are trying to do our best, but not.
I do want to turn to the students to ask questions, but I'm just going to, John, do you have any follow-up? Okay. Okay, so I'm just, I'm going to turn to our three students first to ask questions before we open it up to the bigger.
Hi, I'm Mira. I'm a sophomore global health major. And I was wondering when you were pursuing your PhD and you were like a lot of programs were not interested because it wasn't a big topic yet. What drove you to keep pursuing it and not like change what you were gonna focus on?
It's a really good question. Um, I, uh, I, I was pretty driven by content and not methods. I mean, you have to clearly get smart on methods, but I was interested in methods to answer certain specific questions. So it was never. So I had been admitted to infectious disease epidemiology programs that I decided not to go to because I would have gotten fantastic methods, but maybe not be allowed to work on the content areas I was interested in. And it was way more important to me to focus on this thing that I was driven by. I think if anybody ever goes and does a PhD, you better love your topic because you're going to hate it by the end no matter what. So, because it's just it becomes your life, so you better love it at the beginning. And for me, that my interest and my passion was on the topic. It wasn't on necessarily, how to calculate Shepard's lemma. Please don't make me calculate Shepard's lemma.
I'm Zach. My question is, what do you think the most beneficial aspect of working at the Defense Intelligence Agency was? And then I was wondering if you could talk more about yellow rain.
Yeah, I think it's working. So my dissertation was a really long time ago, but I actually just had to lecture on this in a class this week, so memory is slightly jogged. So the topic of my dissertation was about how to combine different types of disciplines to be able to do an investigation of an alleged chemical or biological weapons attack. So how do you combine epidemiology and intelligence and law, all these pieces? How do you bring them all together to do an investigation? And then how do you weigh the evidence that you find and the different standards of evidence from different disciplines? Like how much evidence do you need to treat a patient versus how much evidence you need for a court of law versus how much evidence do you need to, say, take military action? And those are very different evidentiary standards. And so for this dissertation, I had the unique opportunity to work on a historical case study, and that's called Yellow Rain. So these are alleged toxin weapons attacks starting in '76 and going into the early '80s. The allegation was that the Soviet Union directly against the Mujahideen in Afghanistan, the Pathet Lao against the Hmong in Laos, and Force Against the Khmer Resistance Group in Cambodia. The allegation was that these forces were using a trichothecene mycotoxin. And the allegation was that a kind of crop duster-like plane would fly over at a lowish altitude and release a cloud that felt like rain. And often that cloud was described as being yellow and sometimes in other colors. Thus the term yellow rain. And it was incredibly, it remains a very controversial subject. I'm not sure I knew what I was getting into when I waded into the topic for my dissertation. but it remains that the United States came forward with an allegation that this was a use of trichothecene mycotoxin, which it's a war crime. I mean, it's customary international law. It's against the Geneva Protocol in 1925. And there are allegations that somewhere between 10,000 and 40,000 Hmong were affected. Subsequently, an academic team came out and tried to disprove those allegations by saying that in fact this was just actually a naturally occurring event of Asian honeybees defecating en masse in a way that is actually a phenomenon that was described by Darwin of yellow rain. But the point of my dissertation was not to prove or disprove. It was instead to use this as a case study to look at how do we do these types of investigations. In the process of reviewing a new body of evidence, though, I personally came down on the side that I thought the evidence clearly supported that in fact trichothecene mycotoxin was used, which I still get phone calls and contacted at odd intervals about this very issue. I have no idea if that answered the question that you were interested in. Okay. Well, I never really worked there. I was an intern. So honestly, like as many interns are, it was more of a learning experience for me. I'm not sure how much I actually contributed. And part of it was just learning like what that organization did and how it contributed to this larger effort across the United States government. But I think to be probably the most rewarding thing was just meeting a group of people who are often not acknowledged and who wake up very early hours, go to work, do their job, supporting this larger effort, and with incredibly deep expertise. I have to say that I think I learned more camping out in my mentor's office for 3 months up at Fort Detrick than I had learned in about 7 years of graduate education, which was frightening, but also really exciting. So.
It reminds us why we often tell people take time off before you go to graduate school. Internships, even if you feel like you're not learning, you actually are. And so I'm going to open it up for other questions in the room.
Hi, I'm Victoria. I'm a junior, and I wanted to ask you, so across your career, there have been several pandemic outbreaks that have occurred, and I was curious if you believe that the international response has improved across these different outbreaks, and are we better equipped now to deal with the ongoing coronavirus outbreak than we were previous ones? And if so, how? If not, why not? And that kind of thing.
That's it?
Yeah.
That's all you're interested in? And I don't know what the rules of the road are here, but I would love to throw this to some others in the room too. But I think the easy answer is yes. We are absolutely better prepared now than we were 5 years ago, 10 years ago, 20 years ago. Are we prepared enough? No. How's that for a really simple answer? It in part because this stuff is hard, right? And it's hard to know what the next thing is going to be. It's hard. So it's hard to talk about fighting the last war. A lot of times you people focus on well okay great we had Ebola, now we're gonna develop Ebola plans and we're gonna figure out how to do that. And instead, we lived in this really, complicated world where you can't always predict what the next threat is going to be and how that threat is going to diverge from what the threat was before. So trying to keep up with nature is hard. And the other thing that is very complicated is we talk about in the field about this cycle of panic to neglect. When you don't have an emergency in front of you, decision makers often start to neglect this base. For very practical reasons, that if you have a budget of $100, you got a lot of things you got to spend that on. And if you are, say, a country that has a really high burden, under 5 mortality from malaria, and somebody says, okay, but I want you to focus on preparing for Ebola or for a coronavirus, and you're in that country like, well, I got to worry about malaria first. I understand that this is a problem, but here's the resources I have, and here's what I have to deal with today. So I think it is a real challenge in this field to figure out how to capture the imagination of folks, and the importance of long-term preparedness, planning, and response, how to think about, and at the same time also how to think about, I mean, we call them like best buys, like what can we be doing that improves the infrastructure for dealing with malaria at the same time that it is also building a functional workforce and laboratory capacity and epidemiologic surveillance and strong communication networks and all of these things. And that's hard given like how global health is actually organized, right? So much of everything in this field has always been done in very vertical systems. And so how do we start to break through those vertical silos to start thinking about horizontal systems? Can I put you on the spot, Bruce? Do you want to take a stab?
So I think and it's been fun
You
hearing.
have to stand in front of the camera, though.
Come on, it doesn't.
Yeah, absolutely. If I have to, you have to.
That's
No,
the
I think,
job.
well, and I hadn't heard your story. I heard pieces of your story before. We grew up in the same hometown. Imagine that.
You got to do a quick shout out to West Hartford, Connecticut.
But I think that part of the problem is the expectations that we can control this stuff. These are big scale emergencies. Look at the fire in Australia. It's not like you could, put that out like you would if your socket caught on fire. These are not so easily controlled. And so I think part of this, when you hear people say, "Oh, we got it, we're under control," that's a huge problem because people think you can actually do it. So I think that some of these you might be able to do, but some of these are not. And I think that setting the expectations that this is the 21st century, we're a rich country, we have the best technology, everything, we can do this, is a problem. And people want to appease the politicians, and they want to appease the public that stay calm, we got this. Modulating that message is difficult. So I think the expectations are a big part of the issue because some of these things just are not controllable, and you have to do the best you can, and we've done a great job at improving that. The other piece of this is and frankly, one of the things that's it's vastly improved is the coordination, and what that really means is how quickly things happen. Because what the most important thing here is time, and so early warnings is really important, and then early response, and then as Rebecca highlighted in your dissertation, there's a lot of different players in this thing, and the quicker you can get them to all come to the table and figure out what to do and who's got to do what in which lanes and who you need help from is really going to make a difference. So that's vastly improved because in the early days it was the Keystone Cops, and over time it's gotten a lot better. And there are structures in government now that really help that. And I don't know how, I was in government for a while, I don't know how it's working currently, but that was, when I was in government, that was the most impressive part, to see people come around the table, they're all after the common goal, coming at it from different lanes and trying to figure out who was doing what and how you could get help from somebody else.
Worth quick mentioning what you did in government.
I went to a lot of meetings, I typed a lot, and I was on the phone a lot.
You did all those things very well.
Yes, we did. No, so I had this, so I was at the Department of Health and Human Services. The role was called the National Vaccine Program Office. And when I went to interview for this position, the one question I had was from the then secretary was, well, why don't we have a national pandemic plan? And I had a reason for that, and he didn't really care about my reason. He goes, well, just do it. You got to write it because we were not prepared. And this is in the days of the early days of bird flu. And the question, because there was a lot of concern about another virus, this is an influenza virus that was in Hong Kong. You may remember this story, I've read about this story, that the first thing the Hong Kong government did was killed 100 million chickens. So then that was a huge order to do. The person who actually demanded that was the head of the health department in Hong Kong, who then later became the head of the World Health Organization. So I had a lot of experience in this. But that was what, when I came to government, that was what was on the table. And I think the most ironic story was, this is before I was there, when this question came up of why don't we have a plan, there was a briefing with the Secretary of Health, and that briefing was at 8 o'clock in the morning on 9/11. They're in the middle of that briefing, somebody says, hey, you better watch TV. That changed the day, and a year later, they came back to this and said, okay, now we got to get serious about it. That was about the time that I entered, and now was handed this. So I had that, the opportunity, responsibility, and probably more important, the authority from above that had to do this. And when you have that, people have to listen to you. You say, well, I'm just doing this because they said I have to do it. And the they percolates all the way up to the White House. And when you use that card, if it's true, you get attention.
Hi, my name is Clara, and my question is about the coronavirus specifically. And it's regarding the fact, like, when is it appropriate to declare a public health emergency? And I'm wondering, what is the difference between actually taking the measures as if it were a public health emergency, rather than declaring it and having people freak out? But I'm just wondering, what would be the drawbacks of declaring a public health emergency before it actually becomes an emergency?
I'll start, and then I'm going to pass the microphone. So, you ask a really excellent question, and one that is on the mind of a lot of people right now. You could have a very strict legal interpretation of the international health regulations, and many who are true to the text believe that and I'm one of these people, are slightly dumbfounded that we have not already had that declaration. But I was also wrong a whole bunch of times in a row for Ebola DRC, where I also was like, well, it looks like you've clearly met the text for what would actually be declared. That being said, these declarations are very political. And so there seems to be a lot more going into the decision than just whether it is a unusual, unexpected, a serious public health event that has the potential to cross borders. So the basic tenets that for the basic things that have to be met for that declaration, that's not all that's going into those discussions. Now, I think still, I would assume that the declaration will be made in the next week. Again, I was wrong a whole bunch of times with DRC before that happened, but yes, that would be my assumption. Does it matter is your second question, really, is, and that's also a really interesting and important question to be asking. If it doesn't matter, then we really need to revisit the international health regulations. I think there are clearly a lot of actions that are being taken no matter what, and things are happening to try to coordinate the global response. And a question that I get anytime I give an IHR lecture is these, what does it mean to actually make the declaration? What changes? And I think the main change, if anything, is it's a political declaration. And so it carries political weight. And that can be extraordinarily important for some things and not at all relevant to others.
Just between Bruce's comments and Rebecca about sort of how political this is, and how you really need, it's governments are saying messages that they know the population needs to hear, the politicians need to hear. of one other thing that we sort of actually haven't talked about but is critical is the role of diplomacy in being able to achieve any of these prevention, the detection, prevention, response. And so I didn't know which of which of our guests wants to speak about, not it's the technical expertise, but it's also deeply political in how you're going to achieve those critical global health goals.
Yes, yeah, but I think stratifying that in terms of preparedness planning versus in the immediacy of the response. I think now there still has to be that element of diplomacy, but it's different when you're around a negotiating table to try to figure something out for the next time to make things better, which goes on a lot. And I'm always amazed by the people who do this kind of work. This pandemic influenza treaty took 4 years to do. And I commend those who worked on it, who had to be at the table all the time to try to work on those things. So I think it's a little bit different than in the immediacy of response. I think that's where it's more politics than diplomacy, and some politicians are diplomatic, and others are not. But I think that's really part of the crux of this. And I was struck by something I saw today from the business sector. They're already acting this way. They're taking away from out of China. They're limiting travel. There was something about, I'm not working for them, but iPhone supply is going to go down because the factories that make them, if they're called factories, are going to not be up and running. It gets into the global supply chain of all this stuff that comes through China, particularly. That's why we're out of face. I mean, all the face masks, I understand, are made in China, so they're probably there, or they're going to not be able to make them, or something like that. So there's a whole supply chain aspect, and I guess my thoughts are that it's the politics part, but when it gets beyond health, it gets into the global economy of travel and trade, and with that stigma and the ability or inability for people to move. I think frankly, I'm not part of any of this stuff, but you can already see based on some of the conversations how the movement of people and immigration policy is going to get swept up into this as well. So watch this space as well as things get.
I think I don't have too much more to add other than to sometimes people look at legal instruments and think that there is a precision, that the words can describe everything, and law is really important, and I do believe the IHRs are important, and I think if the provisions of it are irrelevant, then we have to go back and figure out some other mechanism for understanding how the world community is going to work together in these kinds of events, because Bruce and Rebecca, both, these are catastrophic events that require international cooperation. Not only can the richest country in the world not handle it on our own, the world coordinated, as far as we know, can't address some of these things. But to your point, I think all these, when you're in real time, I think politically you have to think through the consequences. So an upside, arguably, is you can draw attention to an issue and mobilize resources in countries that might not otherwise have them. China's the second largest economy in the world. They put 20 plus million people under some kind of lockdown or whatever it is, well, it's just going to, so it's not clear to me that a FIIC is going to, as a public health emergency of international concern, is going to generate more action than has happened. And maybe there is. You have to think through the downside. What does it mean to the country that's impacted by it? Do you want to further drive potentially negative economic consequences that could we didn't talk about China's behavior during the SARS epidemic, but outbreak, but that was a situation where keeping information out of the global public domain was the way the Chinese operated. I don't think we ever want to reinforce that behavior. So you got to think about not only the immediate consequences, but what signal does that send to countries? Another country I think about when I first met Dr. Gellin was during the H1N1 outbreak, and I think we were in the same room when the public health emergency of international concern was declared by the Director General. But the first country to be upfront about the problem was Mexico. And they it was not at all clear that Mexico, after making that declaration and fulfilling all their IHR obligations, it was not at all clear that when vaccines were being produced that they'd even be on the list. Now, that's a crazy set of incentives to set in motion. So anyway, I'm not saying that's the case here, because China obviously is a high-capacity country. But my point is, there are you can think of it as a non-health considerations, but they are. And you got to think through the trade, you got to think through economics, you got to think through the incentives for the next event. And I think there's no way around it.
I would just add, but you also have to think about what is the message if this is not declared? Then what is a public health emergency of international concern? And to John's point, one of the things that we've been pushing for actually a couple of years, but we've kind of reiterating a call for it, is an idea of, so you never want to reopen the text of a treaty because that's painful for everybody, and you sometimes think people who go through these treaty negotiations have like PTSD afterward. Like you never want to reopen the text of the treaty. That being said, in the arms control world, we have what's called review conferences. So for the Biological Weapons Convention, every 5 years, the member states get together and come to a set of understandings around each of the articles on how they're going to be interpreted and implemented. And it's a way to keep an agreement alive and fit for purpose. And one of the things that we keep seeing some interesting interpretations of the international health regulations and calls to do things that aren't there. So there's been a lot of talk about, well, it's not an international emergency, it's kind of a regional emergency, but that's not written into the text. So if the global community, if the member states think that that's something that's important, should we actually be creating tiers of emergencies? Then we've been calling for that as something that needs to be put back into the hands of the member states to discuss and come to a consensus agreement or some type of understanding on how to keep this agreement alive and again fit to being able to address today's problems. So we have called for an IHR review conference. Clearly, this is not the thing that we're going to do this week, right? Like these are not the types of things you do in the middle of an emergency, but they're important. And to your point about what can we do in academia? Well, if we got a whole bunch of smart legal and governance scholars around the world, this is something that they can be working on so that when the member states have a chance to breathe and to think about this, that we can be force multipliers for them and be like, well, here's some analysis that's been done and for things for you to consider.
I think the review conference is a great idea. What has happened after every other major outbreak is that there's been a review committee of experts that basically come in and say the global community didn't do A, B, and C, and they're right. I mean, these committees are, but then they go away. And so then, they don't always create the political dynamic to do what Dr. Katz suggested, which is if you want to have either a review conference of the IHRs or you want to have a resolution that the World Health Organization could pass, it doesn't even have to go through a full lawmaking process. But if you want member states to agree next time we should do D, E, and F, not A, B, and C, because that's what will be better, then we shouldn't always have Monday morning quarterbacking kinds of reports. We should figure out how do you create a political dynamic where people say, all right, next time we should do D, E, and F. We got to be starting to think about that because the gotcha thing is useful if clearly mistakes were made. I'm not saying we should hide anything, but we got to be thinking about how do we improve because gotcha doesn't always get people to the table.
My name is Cameron, and my question is related to what we've been talking about. Is how do you feel that the Chinese government has responded thus far in relation to the new virus, in comparison to how they responded to SARS, if they've improved any? Still room for improvement.
In SARS, the virus emerged, and it was many months before the Chinese government shared what they knew with the world, with the global community, and it was prompted by cases leaving China, and so the global community already knew, and so it was really China responding. They and this is why it was the impetus for revising the international health regulations finally. So it was all the problems that came up in the response to SARS then got fed into the revision of the international health regulations. China knew that, right? So they knew that, and they've spent a lot of time and money, and they revised their disease surveillance systems. They have worked hard to become a better global actors in global health. So they've put a lot of effort into being a better global actor. When the novel coronavirus emerged, the information has been shared at a speed that we hadn't seen before. Genetic sequence data has been shared. There's a lot of material that is being put out there. Yet there have still been accusations that the government is not being as transparent as they could or should be. I don't think we know enough yet to say anything definitively about that. I think that we can say that there has been a lot of information that has been provided. The Director General is there right now. They have invited a team from WHO to come in. Are they behaving the exact same way a different government might? No, but it's hard to actually say. I don't want to come out and say, you know, they should be doing this. I'm like, well, they're doing a lot. Are they reporting everything? Probably not. Is that because they haven't been able to detect everything? Is that because their system that they have in place has to go through multiple official checks before information can be shared? I think there's a lot of things going on, but I don't. And you're going to hear a lot of voices, which is the beauty of social media, but also the challenge of social media. So I personally don't feel comfortable saying, you know, yes, they're not sharing information, or they should be doing more. I think that this is a rapidly evolving situation, and to date they have been solid global actors. You want to look into the camera and say something else?
Only that. I mean, I have no insights into any of this because I'm out of it by a couple of layers. But at least as a citizen, what you can see is that at the highest level, there is action and attention, and that is getting responded to. Whether or not they're doing all the right things, that's a separate thing. But you can see this matters. You know, you can also speculate this is a time when, as you said at the beginning, this is a shift in sort of global dominance, and it may be an opportunity for China to take a leadership role in some of these things, and that may be part of this as well. But at least what you can see, I mean, just what you read in the paper, is that this is going on at the orders at the top, and I think that speaks a lot. And it gets back to what I mentioned before about speed. So this one apparently is, I mean, we don't really know. I think we'll learn over time when this really started. It always starts earlier than you first see it. So we might learn that this has been percolating. I don't know, but it had been percolating for a while until it exploded. So we'll learn some more about it. But I think the speed of this is also helpful, and particularly as in the sharing of information, so you can have a response. There are now, if you had different people coming here, they would tell you that everybody who's got a technology is going to the government to say, if you give me $100 million, I can make my trick turn into a vaccine. And the only reason you can do that is because the information's available, the virus is available, the sequence is available to actually start doing those things. And in the past, that was problematic. There were past issues where countries would hang on to stuff because they said, hey, unless we get something out of it, you can't have it, or we'll give it to some people and not others. That's changed a lot. I'm sure that could be improved, but that's changed a lot, again, because the time is what matters most.
From what we know, it seems.
Hello, my name is Nate. I'm actually from Farmington, Connecticut, so the greater Hartford area is well represented. I'm okay. Absolutely, yeah, we come down here. And so my question is perhaps a little bit more on the technical side. But given what we sort of know as citizens about this virus, about 14-day incubation period, the Chinese health minister said that they found it could be contagious before symptoms present. And given how dynamic our population is, really wherever you happen to be in the world, but particularly in places like China where you have massive cities that dwarf even our largest, like Wuhan, how effective is a quarantine? How effective are standard methods of containing virus, temperature scanners at the airport, so on and so forth? And how can we manage something like this, like you said, with an eye towards a marathon rather than a sprint, thinking about the economic consequences that occur when you limit the movement of people?
I'll jump in first. How's that?
Before you jump, I'm going to say that the best part about, and thank you for allowing me to play here and to come to Georgetown, is you guys have the best questions. And the second best part is you come from such different parts of the university. I'm always that's for me, that's the most fun part of coming to these things, to see that from a variety of places you come from, and then you'll see where your trajectory is afterwards, but where you come from. But the questions are always spectacular. And I was going to say that before you spoke, but I didn't want to put you on the spot, but it was a good one.
I feel like I'm going to try to answer your question with a whole bunch of different bullet points. And then we can maybe, somebody else can try to draw the conclusions from that. One of the most important questions that folks are trying to figure out right now is how many people are asymptomatic, and can you transmit the virus when you are asymptomatic? There's been some noise about this. Oh, geez. There's been some noise about this, but we don't actually have definitive answers yet. But knowing that will be critical to thinking about control and mitigation efforts. Questions about quarantine are always, quarantine gets people excited. It's the plot line of a whole bunch of bad movies out there, and it's scary. I think your question about the effectiveness, there's a lot of varying evidence from history about the effectiveness of quarantines, of cordon sanitaires. In this particular instance, the mayor of Wuhan has come out to say that approximately 5 million people left the city before they went into lockdown. So clearly, this is not an issue of containment. Often, in a lot of the models that are done, efforts to limit population movement have contributed to delay of a spread, but not full containment. Delay can be really important, particularly if you've got a whole bunch of people trying to make medical countermeasures. But it's so I don't want to, I think population movement curtailment can be very important when you have a respiratory virus, but I would, it is not an answer for containment. That's my takeaway. What is it? January 28th. Let's document the day, right? Because this is the information is moving so quickly. And what we know right now is going to be different in 3 hours. And all of these pieces of information are contributing to trying to make the best decisions for trying to mitigate the consequences of the outbreak.
So when you talk to epidemiologists, their pride in penetrating Hollywood was getting Gwyneth Paltrow to write in the outbreak, "R not," the reproductive rate. That there was this.
Kate Winslet, actually.
Oh.
Gwyneth dies.
Oh, okay. All right. Sorry. I gotta watch more movies. That's right. This is not really a spoiler. The idea that you put that in there. So this idea of this reproductive rate, how many people will be infected by somebody? So you know this concept? You've heard of this before? So what do you think it is for influenza? So for every person with influenza, how many people will that person infect? Ballpark.
Anybody in my EID class Monday morning? Come on now. We did this.
3. Do we anybody want to go higher? You sure? Anyone want to go lower? Lower. All right, so that's okay. So no, I mean, these numbers vary a lot, but the sort of a number you can think is 1.3, so in that range. So, but how about measles? Everybody with measles in a room that is full of people who've never had measles or measles vaccine, how many people will be infected with measles? 50? Do we go higher than that? Anybody want to go higher than 50?
5 or 50?
50. Anybody want to go higher? It won't matter. It won't matter. The air conditioning won't be on, so the virus is lingering. So everybody's going to breathe it. How many? 50? Anybody want to go higher than 50? Don't. So it's probably 15 or 20. So just think about how that, you don't have to know a lot of math to know how that'll take off. So this one, that's the number that people are looking at in terms of a number, and then your question is about when. Because in SARS, what turned out was that people were infectious only when they were really sick. So they weren't walking around making people sick. They were walking around infected, but not infecting others. And that's the critical question. This one, I think you framed it nice. There's a lot of noise about that. I'm sure that it will get figured out. There's been some chatter. The last I heard, CDC said we haven't seen any evidence for that yet. But that's a critical question because it's a game-changing question for all the reasons that you've raised. So watch out for those pieces. But I think that's going to be so understanding the science is really important. And then you get then the other piece of this is you don't need social media. There's any media because there's all kinds of experts and all kinds of TV cameras that bring those experts in and they say all kinds of things. So it doesn't take much to sort of say something, and now that becomes a challenge and that ripples through. So I think this is infectious before people are symptomatic is in that category right now, but we'll have to see what happens.
Getting close to the end, but let me say two things. One is everybody here benefited. We got 2 for the price of 1 tonight to have Dr. Gellin join us. But I wanted to say, in addition to thank you to Rebecca and to Bruce, but Rebecca in particular, to sharing your story. For those of you who are interested in this kind of work, it's been, listen, I've worked with both of them, but particularly Bruce and I worked on the H1N1 response. I know my last biology class I took was in 1970. So, so that's scary enough, right? And 2 is I was in a position where I had to try to work on some of these issues in real time when we were in a crisis. And so if you're thinking about roles you can play in your life, to be scientific experts that are smart enough to, one, understand what's going on and understand what's not happening and explain where things are clear and where things are ambiguous, where we are in the timeline in a crisis. People live and die based on the decisions that government makes. So if you position, you can be a policymaker and get appointed and be an ambassador or whatever. The other role that you can play that can be incredibly influential is being the voice of science and reason, the people who are willing to say, yes, what we know, no, this is what we don't, to keep policymakers in check in a good way, in a way and both of them are incredible examples of that. So as you're thinking about what to do with your life, this is a way in which you can make a huge contribution to government or on the outside, depends. So anyway, I just want to thank you both.
I actually think that was a wonderful way to end, and I couldn't do any better. So, Dr. Katz, Dr. Gellin, thank you very much for joining us tonight. Really appreciate it.